Hi, everyone. This is Felicia Brown with One Concept Radio, where I'm getting to know experts and educators from the massage, chiropractic, acupuncture, and spa professions. Today, I'm honored to be here with Dr. Brian Stenzler. Dr. Brian Stenzler has been practicing chiropractic for the past 15 years. He is the president and CEO of Dream Wellness and has locations in both San Diego and New York. Dr. Brian is also currently serving as the Vice President of the California Chiropractic Association. Welcome to the interview and to the One Concept Conference in San Diego, Brian.
Thank you so much, Felicia. It's great to be here, and thank you for the opportunity for this interview.
Well, we're just excited to have you presenting, and I'm really looking forward to hear your thoughts on a few different thought-provoking questions and hopefully getting to sit in on your presentation out at the conference.
That'd be wonderful. Make sure you bring a notepad.
Yeah, well, I hope everybody listening's got one because I know you're going to give us some great information today. And first of all, I'd like to hear your thoughts on how you differentiate or define health, sickness, and wellness.
That's a wonderful question, and that's really what I've geared my adult life to, is really teaching people what the differences are. Unfortunately, a lot of people interchangeably use the terms health and wellness, and then they think that sickness is the opposite of that, where I don't agree with that at all. In 1948, the World Health Organization defined health as a state of complete physical, mental, social well-being, not merely the absence of disease or infirmity. And that's a wonderful definition, and if people actually lived by that, it'd be pretty well encompassing. Unfortunately, most people think that when they don't have any symptoms that they are healthy. But one of the big things that I want people to realize is that when you talk about the health as being a state of complete physical, mental, and social well-being, state is static. It means it doesn't change. So it's kind of like where you are. Are you healthy? Are you not healthy? Whereas the word wellness is a process, and you can't get to a place called wellness. You can't say I'm wellnessy. You could say you're healthy. You'd probably be wrong, but you could say you're healthy, but you can't say you're wellnessy. And so the way I define wellness is as the complete integration of mind, body, and spirit, affecting not only your visible body parts, but also the trillions of cells that make up your entire body. And I go on to say it's a proactive approach toward creating physical, mental, social, and spiritual harmony. And how much wellness you have in your life at any given time always changes, but it's much more than how you feel, but it's also based on how you function. So the biggest differentiation between health and wellness with our definition is you can't get to wellness because every decision you make, every action you take, either adds more health or wellness into health into your life, either detracts or adds to, and wellness is the process of creating that or taking away. And so when you have a true wellness center or a wellness practice, it's really important to understand what the difference is and the process that comes with it. And then so a lot of people think that sickness is the absence of health, but that's not true at all. Sickness is just simply when the body doesn't do what it's supposed to do. So when somebody, for example, were to have a fever, the body temperature rises, or somebody has a stuffy nose, or they're sneezing or coughing and getting phlegm out of the body, that's the body's self-healing, self-regulating mechanisms and doing exactly what it's supposed to do, unless it gets to a point where it doesn't recognize itself. That would be. So that's kind of how I differentiate those, and I think it's really an important cornerstone to any wellness business to understand the differences between those.
So let me just clarify that because, I haven't heard that explained quite in that way before, and I'm really liking what you're saying. But so if I have inflammation in my elbow, let's say, from overuse, and I have, I'm feeling some pain as a result, that's not necessarily what you would consider sickness because the body is doing what it's supposed to do. It's trying to heal that area by bringing cells to the elbow to heal the overuse injury that I've created. Is that correct? Or did I misunderstand?
No. I couldn't have said that better myself. In fact, here's where it's a good thing we're on the radio and not on stage with that question because this is where I could get tomatoes thrown at me. Because when I did a master's in sports health science, and I did a kind of pre-thesis on injuries with inflammation. And in my pre-thesis, I basically wrote about why ice is not always the best course of care. And, of course, my instructors and professors kind of wanted to have me thrown out of out of the whole program. Like, what are you talking about? Everybody ices injuries, rice and all that, and then you use heat and everything. But the fact is, when you get inflammation, it happens for a reason. It brings blood flow to the area. It brings scar tissue to the area. It brings the healing potential that was given to us by God. And so when we try to play God and we try to fool our bodies and reduce the inflammation artificially, we're not actually allowing the body to do what it's supposed to do. And so it heals quicker, but not necessarily better. And that's where you end up with a lot of weaknesses. Now, does that say that there's never a time and a place for ice or anti-inflammatories? No, I'm not saying that at all. But we use it all too frequently. The first time somebody gets a soreness or an inflammation, they're just quick to ice it or take ibuprofen instead of just resting it, like in the elbow situation that you're talking about. And I have a lot of people that come and see me with that type of a question, and I give them the disclaimer ahead of time. Standard of care is 18 minutes of ice on, 18 minutes ice off. Let me tell you what I do for myself and my family. And I talk about the innate intelligence of the body that knows a lot more than I do.
Well, I can see we're going to be having some long talks about this in the future in San Diego because I really, I have to admit I'm a triathlete, casual triathlete. I can't say I'm a big competitor out there, but I do enjoy the discipline. And, ice is one of my go-to things for when I'm in pain. I'm thankful to say that I don't have a lot of pain. I don't overtrain. I try to listen to my body. And if I'm feeling sore or if overdone it, I'll take some time off. But, that's what I always reach for because for me, if, people want to put something on it to make it feel better. If I reach for the heat, it definitely does not feel better, and ice is at least soothing.
Well, the best part and the worst part about ice is it works. It reduces inflammation, it reduces the swelling, it reduces the pain, and you feel better a lot quicker. And in some cases, in like a spinal cord injury for something, or an example that could be a life-threatening injury, of course it come in handy. But more importantly, there's nothing better than rest and make sure that you're getting the proper nutrition, and I don't mean just external nutrition of food, but nutrition and healing nutrients to the body and making sure that everything is connected appropriately. And that's where, this is one concept I love so much because so many of the healing professions out there would help, reduce inflammation in a natural way that works with the natural recuperative powers of the body between massage, Reiki, acupuncture, chiropractic, ensuring that the nerve flow is optimized. Those people having on your team after running a triathlon would probably do far more good for you long term than icing every time you get soreness.
Well, Brian, I am a massage therapist, so I am definitely a big proponent of those, of all of those disciplines too. I just can't always get to them at the exact moment when I need them. So, but thanks for giving me a little personal information there, and hopefully some people listening are getting some ahas from that too. But I want to come back to information that you're going to be talking about in San Diego. Because that's what we're here about. We want to get people excited about your class. So in your presentation, I know you're going to be talking about some of the stumbling blocks that wellness providers face. So I'm wondering if you could share one of those common stumbling blocks and perhaps a tip that everyone listening can put into place now to either get past the stumbling block or maybe even to prevent it.
I think that's wonderful, and there are so many. And I'm going to start with probably the most difficult one, and that is to reduce contradictions in your business. It's too often that somebody says that they want to have a certain type of business, a certain type of practice, yet they go ahead and they market to communities that aren't that. So let's say they say that they want to have a pediatric practice. They want to take care of kids and wellness, and they start saying, hey, come for back pain, come for headaches, come for neck pain, and all these other things and then when they have the person come in pain, they're like, it's not about your pain, it's about wellness, blah, blah, blah. And so there's fear that gets into that because they're afraid that no one's going to call them, but nobody wants to go to a jack of all trades, master of none. So they pigeonhole themselves by, reducing what they do, kind of misleading the community because they're not as passionate about whatever it is, but they bring them in through the doors, and then when they come in, they're not actually serving them what they want to be served. So if you really want to have the best, most successful practice, be true to yourself. It doesn't mean don't cater to everyone. It just means market to what you want to market, and you will attract whoever is supposed to come to your office. And trying to be the best at everything is just going to be too limiting, and people see right through it. And it It makes it very difficult to have a successful business that way, and it makes it very successful to have a very happy life if you're serving people that you're not as passionate about in a way of serving them.
Well, definitely. And, in talking with some of the other presenters in these interviews about things like burnout, I think it was Till Lukaw that was who's a well-known massage therapist who was discussing the fact that if you're not passionate, you're really not present in what you're doing. And by not being present in what you're doing, it's taking more energy to have the same level of effect or to, give the client a good experience. And by doing so, you're burning yourself out faster just because you're not happy. Even though the work might be the same, whether you're passionate or not passionate about, the technique isn't changing, but the way you approach the client or patient is making a huge difference, and you're burning yourself out, whereas somebody doing the exact same thing, not a bit different physically, but they're more passionate about it, isn't going to have that burnout.
That's exactly right. I couldn't agree with that more, and that's very well said. I always said the definition of success is when you connect your purpose, your passion, and your paycheck. And that's the bottom line. And if you're not passionate about what you do, you will burn out a lot quicker. And it'll be very hard to have a successful business. So I couldn't agree with that practitioner anymore. Absolutely.
Fantastic. Well, as someone who does business and marketing coaching also for our industry, I have to say I agree completely. Those things, if you can't get them lined up, and not just your passion, but connecting the right clients who will be served by that passion, so that they are coming back and thinking you're great, and you're having a positive effect on them in such a way that they're telling everybody and their brother about you. It really reduces the amount of work you have to do in marketing yourself because they're going to do it for you.
That's right. Absolutely.
Well, I think it's going to be I know you're going to provide some great information in that presentation. One other thing that I want to talk with you about, Brian, is the idea of community. As I'm sure you know, community is a big focus at the One Concept conferences, especially with the recent addition of a community room at their events. So I'm wondering how you see the different healing professions working together or collaborating as a community now or in the future.
Well, I see it a little bit now, but we need to have it a lot more in the future. And it starts in our offices. How do we run our practices? Does one type of practitioner feel that they're in competition with another? How are they looking at it? And I've been working collaboratively with other healthcare providers since I've been out in practice since 1998. And basically my practices have always consisted of chiropractic, massage, nutrition, empowerment coaching, acupuncture, yoga, Pilates. We even do organic cooking classes. We offer so many different services within the confines of our office under one roof, and we work together in such a collaborative fashion that our practice members, I don't even call them patients because the word patient means to suffer, so we have to be careful with our lexicon, but our practice members, they just feel so comfortable coming to us. And so if they're seeing, say, the massage therapist, for example, the massage therapist might notice something and say, hey, listen, have you seen the chiropractor? And then I'll see them and say, acupuncture can do really well with this, blah, blah, blah. And our goal is to get as many people seeing all of us as possible, as often as possible, to be as healthy as they can. I have a lot of people, when somebody has a symptom, and symptomatology is actually a very small part of my practice. I really do have a wellness practice. The majority of the people that come to see me don't come in with symptoms, but there are people that do. And when they have symptoms and, they see that they have access to, chiropractic or massage or acupuncture or nutrition, and they say, well, which one should I do first? I just look at them and I say, yes. It's like, which one should I do first? Yes. If you're going to wash your clothes, are you going to use water this time? You can use detergent, you can use fabric softener. The more good things you do for yourself to bring balance and harmony to your body, the better shot you have of having the healing you're looking for. People don't have any problem taking multiple medications. Oh, you take this medication, but this medication is going to cause you to increase water. So now you're taking a water pill for a diuretic to get rid of that, and they take 5 or 6 medications for one problem. Why aren't they seeing 5 or 6 different wellness practitioners? And it's because, A, there's a financial component to it, which I'm going to talk a lot about in my class about how you deal with the financial part of it, because that's a big deal. But the other part is nobody's telling them. It's as if, there's a competition even within wellness centers. Oh, you have this problem? Well, then you should see me for it. Right. And it's like, no, that's not collaborative. we need to have a community, and I think the best way to create a community is in the confines of our offices and in seminars like One Concept, where chiropractors can learn from massage therapists, acupuncturists can learn from chiropractors. Everybody learns from everybody, and they know who are the go-to people, who they can call with certain situations. But it's not about one profession treating a certain condition, because everything that we do will help a person as a whole, and that's what the holistic approach is about. We're not taking apart what a person's symptom is. What can each of our special trades do to bring balance and harmony back to that individual?
Well, I couldn't agree with you more. And, the one thing that I really liked what you were talking about, I don't know if you even intended it this way. I think you did. But you were talking about, working with symptoms versus wellness. And I think there are a lot of people out there that are really focused on creating that symptoms-based practice instead of creating a wellness-based or lifestyle-based practice. And that's one thing that I'm very excited about in talking with so many different experts that are coming to the conference in San Diego. It seems that their mindset is all about, we're here to create a lifestyle, a practice, a wellness habit, something that people are doing day in and day out to prevent the symptoms and to, prevent sickness instead of coming in only when they feel bad and coming in only to get out of that place of sickness or pain, but, rather than being preventative and looking at it as a lifestyle approach. I think that's so exciting.
Yeah, and I will be elaborating that quite a bit during my presentation at the event.
Well, I think it's definitely a worthwhile discussion, and an avenue that those of us who've been in practice for a while, maybe we might be stuck in our ways, having always done it a certain way or always worked by ourselves. I'm personally very fortunate to be in collaboration with a lot of people and have been pretty much my whole career, but this is an opportunity for people to see new options. And I think that your presentation is clearly going to help outline some of the possibilities that people can take so that they can align their purpose, passion, and paycheck along with, the intention of creating that wellness practice that benefits their patients or practice members better.
Wonderful. That's my intention.
Well, we're looking forward to it, Brian, so that people listening can find out more about what you do either before the conference or in case they can't make it. I'd love to just get your best contact information or website for them.
Absolutely. My website is the World Wide Web, www.dream, like you dream at night, wellness.com, all one word, dreamwellness.com. And I've got a lot of information. It's got my email there. It's got phone numbers to reach me. I'm very accessible, and I love to answer questions from anybody who wants to make somebody else's life better.
Fantastic. Well, thank you again, Brian, for being here for today's interview and for being a part of the One Concept American Massage, Chiropractic, Acupuncture, and Spa Conference coming up in San Diego. We're very excited to have you there.
Well, thank you for the invitation. I'm really excited to be a part of this and to be a contributing factor in anything we could do to help these practitioners, including myself, be even better in serving more people every day.
Absolutely. If you happen to be listening and you would like to come to the conference and learn more from Dr. Brian Stenzler, please join us for the One Concept American Massage, Chiropractic, Acupuncture, and Spa Conference in San Diego, California, September 13th through 15th. Just go to www.oneconcept.com. That's the word one, O-N-E, concept.com for more information and to register. Hope to see you there.